Welcome. If you seek truth, the truth shall set you free. Fear not. And now the agenda with Crystal Risotti.
Hello and welcome to the Agenda with Crystal Risotti. I'm the host, Crystal, and tonight we're going to be talking about global health initiatives. Got a really good show planned. If you don't mind, please like, subscribe, share, and comment so we can get this show rolling and out to as many people as possible. You know, the routine. Tonight we're going to talk about the global health goals and initiatives from the UN and the WHO, and also our CDC in the United States. And if you recall, we talked about in former episodes the UN sustainability goals. We talked about the UN connections and the tentacles that go into every different area and aspect of our lives. So let's look at slide 1 real quick, Josh. These are different entities within the system of the United Nations. Tonight, we're going to talk about the World Health Organization and focus on that initiative and that part of the system, I should say. And I just want to talk about, what does health include, since we're going to be going into the whole health aspect of everything. Health includes physical, mental, and spiritual. Don't be mistaken. When we're talking tonight about the whole health push that we're having, we're talking about mental health, we're talking about physical health, but there is a spiritual health element to all of this, and I don't want that to get lost. So let's start off a little bit talking about physical health, and I want to refer to the Bible so we can go to scripture and see what it says about each type of health that we're going to be talking about. So for physical health, we're going to look at 1 Corinthians 6:19 and 20. The verse says, "What? Know ye not that your body is the temple of the Holy Ghost, which ye have of God, and ye are not your own? For ye are bought with a price, therefore glorify God in your body and in your spirit, which are God's." The point of that verse is we don't own our body if we're Christians. Likewise, the government doesn't own our body. So that needs to be very, very clear. Our body is not ours if we've been purchased by Christ's death on the cross and his resurrection and our redemption. Our body actually belongs to God, not us. So that's important to note. 1 Corinthians 3:17 then says, "If any man defile the temple of God," which we already know our body is, "him shall God destroy. For the temple of God is holy, which temple are ye?" So with that verse, I think it's important to also note that, again, it's talking about our body being the temple of God. And if we defile it, God will destroy it. Let's move to mental health. We're going to look at Proverbs 17:22. It says, "A merry heart doeth good like a medicine, but a broken spirit drieth the bones." Now, I think that's important to look at in terms of like depression and anxiety. And we're going to talk a lot about that tonight, because that is a big part of the mental health initiative that is coming out from the UN and filtering into so many different areas. And we do see a lot of struggles with mental health. And typically we are talking about depression and anxiety a lot. We see so much of that, especially after the C-19 hit and everybody was locked in their homes for, a couple years. It's hard not to experience some of that. But that also can come from childhood trauma. It can come from so many different areas in our lives that we encounter. I will challenge you to tell me one person that has never had some kind of trauma, though. So I'm not a big proponent of taking that too far, but I do acknowledge that there is a lot of that going on in our world, and I believe it's part of the spiritual battle that we face. Moving on to Romans 12:3. The Bible says, "For I say, through the grace given to me, to every man that is among you, not to think of himself more highly than he ought to think, but to think soberly, according as God hath dealt to every man the measure of faith." Why did I pick that verse? I think a lot of our struggles in society with mental health have to do with being so self-centered. We focus on our own selves so much that, number one, we experience anxiety and depression about things that we've done that we can't forget about. We have, like I said, everybody has traumas in their lives. You can choose to sit and entertain your thoughts about that and dwell on it, or you can focus your energy towards others, which is a huge, huge, huge help when you're struggling with something that is plaguing you and it's all about yourself. That's why I chose that verse. And then let's talk about the spiritual health. 2 Timothy 3:4. This know also that in the last days perilous times shall come. For men shall be lovers of their own selves, covetous, boasters, proud, blasphemers, disobedient to parents, unthankful, unholy, without natural affection, truce breakers, false accusers, incontinent, fierce, despisers of those who are good, traitors, heady, high-minded, lovers of pleasures more than lovers of God, having a form of godliness, but denying the power thereof. From such turn away. For of this sort are they which creep into houses and lead captive silly women laden with sins, led away with diverse lusts, ever learning and never able to come to the knowledge of the truth. So many of those things apply, I think, to our cultural struggle with mental health. We see this a lot. Again, all of the things that were listed really start off with the first one that says lovers of self. And again, it goes back to what I was saying before. I believe very strongly, from personal experience myself too, that we can take things so deep with ourselves and become self-obsessed that we forget about what's going on around us or about others. We don't see the flowers, the trees, the things that God has given us, our blessings. We don't see people that may need help with groceries at the grocery store, or some elderly person that might need you to hold the door for them. We tend to either go into robotic mode and deal with those things, or we just don't see them. We don't see the opportunities. And at least from my experience, whenever I've gotten to that place, one of the best things I've done is go to a grocery store or a strip mall somewhere or a gas station, and I seek out opportunities to help others, because I acknowledge that God's order of importance is God first, others second, and ourselves last, which is totally the antithesis of what we're preaching in culture today, what we're telling kids. I see love yourself all over the place. Kids are being taught that. And I do think there's an aspect to that of, I wouldn't say love yourself. I would say acknowledge that you're a gift of God, made in his image. However, we're also as filthy rags, as Christ said in the Bible. So we need to keep that proper perspective about ourselves. And again, best solution for depression, anxiety for myself has been go out and seek others to help. Because at the end of the day, you've accomplished something. You feel good about yourself. You know you brought value to somebody, and you can sleep better. So knowing all that, it seems the Bible is telling us to do the opposite of what society is telling us, to be happy and healthy. Today, again, we're going to talk about several developments that have happened recently or are ongoing now in regards to physical, mental health that actually affect our spiritual health as well. So I want to kind of touch back. We talked about the sustainability goals, which is part of the United Nations Agenda 2030 in the last episode. So let's look at slide 2. These are the list of 17, and you can see number 3 is highlighted. That's the one we're going to dive into today. Let's go to slide 3. This is a bit more granular in regard to slide 3, or actually goal 3. And it talks about ensure healthy lives and promote well-being for all at all ages. And I want to highlight that, all at all ages. So the United Nations is inserting themselves into our physical and mental health aspects. They're not limiting it. They want it to be for everyone, no matter who they are, no matter what age. So think about that. They want to insert into physical and mental health for children, toddlers, all the way up to geriatric ages. Why would a government feel that they're qualified and the authority over everyone to dictate their opinion on healthy initiatives? What would even give them that desire to do that, or that arrogance to think that they're the authority on all of that? I believe, and I mentioned this in a previous show, the end times eschatology in the Bible, talking about the last days. I couldn't, as a young person, figure out why getting a mark would be against God. I couldn't figure out how, following the government's authority would be against God. But he was clear about it in eschatology that if you take the mark, you're done. Your soul is done. You've sealed it. And you will not be going to heaven with that. It took me a long time to figure out that all of this is really about who is your God. The United Nations and other entities, because we have it infiltrating into country governments individually as well, are trying to play God. Why? Because they don't believe in God, first of all. But it all goes back to the spiritual battle at the Tower of Babel, really. Because at the Tower of Babel, the whole point was we, mankind, can build a tower to reach heaven. We can be like God, just like Lucifer said in heaven. He believed he could be like God. God cast him out. His whole intention is to destroy humanity. That's it. He hates the fact that Jesus came and died for us, but not for him. He hates the fact that he can never be forgiven. His whole intention is to destroy humanity because that was what God made and that's what God said was good. So how's he going to do that? Well, he's going to use government to do that. Now, is all government bad? Absolutely not. Absolutely not. In fact, God did put the leaders in place. He said that. The leaders that are set up, he sets them up. The ones that are torn down, he tears them down. Ultimately, he's the authority even over them. I absolutely do not agree that all governments are bad. I'm not an anarchist. I don't want to overthrow the government, anything like that. It's not about that. The whole point of this is let's look a little deeper and figure out why we're seeing what we're seeing coming through and the spiritual implications of it. So I want to point out the things that are mentioned on that slide. If we can go back to slide 3. Child mortality is one. AIDS is another. Vaccines is another. Health funding. Prioritizing women's health during pregnancy, which I find that one especially ironic because it's a little bit deceptive. When you're saying that you're prioritizing women's health during pregnancy and you're pointing out that statistically how many women are affected during pregnancy, what you're really saying is abortion, because you want the woman to be prioritized over the baby. So another little deceptive thing that happened that I think is really important to focus on. Let's go to slide 4. This is from the Sustainable Development Goals Report. I just want to highlight that statement at the bottom. It says, we must rise higher to rescue the Sustainable Development Goals and stay true to our promise of a world of peace, dignity, and prosperity on a healthy planet. So notice how they link the Sustainable Development Goals with things like world peace, dignity, prosperity, and climate change. Those are not... It's so hard when you're trying to explain this to people because they all sound so virtuous. Who wouldn't want world peace? Who wouldn't want dignity or prosperity or climate change? The problem becomes when you're talking about that, somebody has to define what those are and somebody has to enforce it. All right? And that somebody is not God, clearly. That somebody is some man or group of men, mankind, women, whatever, some group of leaders somewhere that are dictating that to all of us, little people. So that's where the problem comes in. And when you're talking about secularism and humanism versus Christianity and following Christ, they're two totally different worldviews, two totally different things. So those people that are in those leadership positions, I guarantee are probably not Christians. Therefore, you have a secular group of leaders dictating to all the rest of the people what they think they should be doing that's virtuous, according to their definition of those words. That's the problem. Christianity is all about individual responsibility and individual freedom to choose. There's the law that we're to follow, but it does not restrict us in our daily decision making. Whether I'm going to use electric vehicle charging stations or whether I'm going to have a gas-powered car. It doesn't impact that decision making. But guess what? The UN is trying to impact that decision making ability on our part. So it becomes somewhat of a slavery type of situation or a fascism, if you will. So let's look at slide 5. Slide 5 is again from the Sustainable Development Goal Indicators from UN.org. And it's talking about life expectancy, immunizations, anxiety and depression, which is the mental health aspect, and universal health care, which is a socialist and or communist way of handling health care. Do we want everybody to have access to health care? Absolutely. That's the right thing to do. But do we want them telling us which doctors we can go to and how long we have to wait before we go and controlling every aspect of our health care? Because that's exactly what's going to happen if we have universal-based health care. We will no longer have the ability to choose the doctor we go to. We will not have the ability to control any wait times. We won't have the ability to control any pricing. It's all going to be controlled by someone else. Now, you could argue right now it is anyway, because insurance companies have a lot of say-so in that, and then your healthcare provider organizations also set pricing according to contracts and things like that. But we have the freedom to shop around right now. And with this, you will not have that. So let's look at the connection to the specific communist goals. Let's go to slide 6. This one says, promote the UN as the only hope for mankind. If its charters rewritten, demand that it be set up as a one world government with its own independent armed forces. Now, that's an actual goal that they put in writing. So they're wanting to promote the UN as God for mankind. It's very clear. Let's go to slide 7. Support any socialist movement to give centralized control over any part of the culture, meaning education, social agencies, welfare programs, mental health clinics, etc. This is right out of their own website. So I didn't make this up, and it's not my typing. These are screenshots off their webpage. They're calling it out. They want socialism to be incorporated in. Again, these are actually from the communist goals that we talked about in episode 2. So if you haven't watched that, you need to go back and watch it. This is the communist goals that were read into the congressional record in America in the 1960s. And they've been working at it ever since. So let's look at slide 8. Transfer some of the powers of arrest from the police to social agencies. Treat all behavioral problems as psychiatric disorders, which no one but psychiatrists can understand or treat. All right, so you got two things here. We've seen this occur in our culture fairly recently, although it's kind of died down. But they wanted to defund the police, and then they also wanted to put social workers partnered with police to go on calls, which personally I think totally puts the social workers at risk because they don't have the training to defend themselves should an occasion arise. But that's beside the point. That's just a push on the social aspect and the mental health aspect. And then they want to treat all behavioral problems. Think about that. Behavioral problems as psychiatric disorders. And they want people or children, wink, wink, with psychiatric disorders as behavioral problems to only come to psychiatrists for treatment. It's interesting when you read these, if you look past the obvious and you kind of analyze it behind the scenes, how these all start coming together and you start seeing how they're playing out. Let's go to slide 9. Dominate the psychiatric profession and use mental health laws as a means of gaining coercive control. I want to highlight that word. Over those who oppose communist goals. When you read the whole of the communist goals, you're probably not going to agree with a whole lot of them. And this is talking about using mental health laws as a means of gaining coercive control. I also want to go back to coercive control. I know with the pandemic, people were faced with losing their jobs if they didn't get the jab. The other side kept saying, well, it's not that they're being forced to do it. It's not mandated. They still have the choice to not do it. But I'm telling you, coercion is control. Yes, they can still do it. They're going to lose their job. They could still say they're not going to take it. They're going to lose their job. And many did. Coercive control is control. So, and they're saying here that it should be used over those who oppose the communist goals. So, again, back to some of the ones that we looked at in an earlier episode. There's 45. You can find them online and in the references from the page or from the episode before. Things like the breakdown of the nuclear family, the distancing of children from parents. So many different things in those 45 goals that many people would not agree with if they just knew. But yet they're using the psychiatric profession to exert coercive control over people who don't agree with those goals. We are seeing that being enacted too. Have you heard of red flag laws? That's one thing. You know, somebody had an episode or somebody didn't like something they said, they can call them in and they can restrict them from having a gun just based on that because they're calling it a mental health or a behavioral issue. All right. You have that. There are people that are using this to get people fired from jobs or keep them from getting jobs. You have people using mental health laws to absolve themselves of doing things that they need to do on a daily basis or getting in trouble at work. That's another one. You can't fire people for misbehaving because of mental health issues. It's being overused, but we see the intent behind it. So now let's move on to the World Health Organization. There's something called the Pan American Health Organization, And that organization is actually an arm of the UN and the WHO dedicated to the Americas region. Let's look at slide 10. This talks about Millennium Development Goals. And I just found that interesting because when we speak as Christians about the millennium, what are we talking about usually? We're talking about the 1,000-year reign of Christ. Why would they choose to name the goals Millennium Development Goals? I just found that very intriguing. But when I did some research, these are actually the predecessors to the Sustainable Development Goals. And they were trying to achieve these Millennium Development Goals by 2015, and then they didn't. So they created the Sustainable Development Goals, and they just rolled the ones they didn't achieve into that. So that's how that all came across. But do you see the connection to the millennial reign of Christ? It's so funny how things work that way. The WHO works with 5 partnerships with over 100 collaborative arrangements and over 800 collaborating centers. It's huge. And there are 195 countries in the world, and 194 of them are in the WHO alliance. So you want to talk globalism and worldwide involvement. You're seeing it here. Let's look at slide 11. This is a composite of the Global Health Initiative, again, right off their website. You see global health in the middle. Around that, you see global health governance, data collection and communication, preparing for pandemics, sustainable development and universal coverage, environmental health and climate change, shifting demographics and lifestyles. And then there's a whole bunch of little things outside of that circle. So I just want to let you know what some of these are because I think it's important to point them out. As part of the global health governance part of this circle, underneath that, they have mental health, social protection. What does that mean? Agile governance, humanitarian action, sustainable development, aging and longevity. And then we go to data collection and communication. And this isn't a comprehensive list I'm reading. I'm just pointing out some of them that I found interesting. Under data collection and communication, you have biotechnology. You have digital communications. You have future of computing. You have health and healthcare. So all 4 of those were in that data collection and communication piece. Preparing for pandemics contains infrastructure, global risks, the 4th industrial revolution, which I did a little digging on that because I've heard that term before, but I didn't really know much detail about it. And our lovely friend Klaus Schwab of the World Economic Forum is the one that named it that. So it's basically a fusion of technologies that blur the boundaries between the physical, digital, and biological worlds. And that's off their website definition. So we're talking AI, robotics, the Internet of Things, blockchain, which is like cryptocurrencies and NFTs. You got 3D printing. You have genetic engineering and quantum computing and so many other things. I want to talk about that for a minute because this is where you see like Neuralink from Elon Musk. This is where you see transhumanism is what it's called, merging of technology with humanity. That's where that falls under. And they actually have a name for it and an initiative around it. The next thing is also incorporated in is trade and investments, vaccines and migrations. So we just had the pandemic. We've seen the vaccines be pushed. Now we're seeing migrations happening worldwide. Why do you think that is? Do you not think there's an orchestrated effort behind all of the migration efforts worldwide? There is, let me tell you. Part of their equity program is to force countries that are more well-to-do to offer up more for less developed countries. So basically, it goes back to the Marxist ideology of take from the rich and give to the poor. And that sounds so great, but like I tell people, it sounds great until you're the rich one. Because even if you're minimum wage, you're better than the homeless guy down the street. So if you think you're immune from them taking from you to give to someone else, you're not. And you need to open your eyes and think broader about that. Sustainable development and universal coverage contains things about food and beverage, social justice, education, human rights, gender falls under that. Why are we seeing the big gender ideology push right now? Because it's part of the sustainable goals. Environmental health and climate change contains things about urbanization. And one of the topics we're going to talk about in a later show is the war on farmers and what we're seeing worldwide about the scarcity of food and the transition of food over to insect proteins and lab-created chicken and things like that, and why they're doing that. It is intentional. It also talks about the ocean. Education is in that. Social justice, human rights, gender, environmental health, and climate change then has the development and finance side of things, the future of the environment, the ocean, air pollution, climate change, water and forest. And then you have shifting demographics and lifestyles, which is your youth perspectives. So they're focused and targeting in on how children are taught and child psychology and things about that. Values, behavioral sciences, global governance, and corporate governance. Now, I find it interesting that all those things are grouped together because you're talking about values and how you're teaching youth to exist in the world today. Couple that all with behavioral sciences, which is your behavior disorders, which we already talked about, right? They want that to be under psychiatry to deal with that. And that ties in with global governance and corporate governance. And we talked before about ESG scores on the last episode and the corporate compliance model and how that is directed by the UN. So all of this is all tied together. Basically, I'm going to go back to this because when we talked about behavioral development and values, why, again, tell me, does some government or government entity feel that they have the right to teach people values and behaviors? That has had nothing to do with the political arena, really. We legislate laws, that's true, and that's behavioral. So if you murder somebody, then you have consequences to pay, and that is directed by the government. But it hasn't always been. We've been self-modifying. We've been self-managing, all right? And we should be. And so I don't feel comfortable with some secular organization telling me what values I should have. What if we conflict? Then what? It's risky. Now I want to move to something called the Pandemic Treaty. And we touched on that briefly in a former episode, but I'm going to do kind of more of a deep dive on this. So there's a new treaty from the WHO and UN, and I'm using them interchangeably because the WHO is a part of the UN. This treaty is for member countries, and it's been written in an effort to strengthen the efforts to prevent a pandemic, prepare, and respond to one. That's what they define it as. Right now, it's in draft 0, and it's scheduled for a vote in May. So member countries are all contributing and tweaking the draft 0, trying to get it where it needs to be. Let's look at slide 12. According to this, negotiations on new rules for dealing with pandemics are underway at the WHO with a target date of May 2024 for a legally binding agreement. I want to point that out. Again, this is directly from the WHO's website, actually the World Economic Forum's website. It states right there it's a legally binding agreement to be adopted by the UN Health Agency's 194 member countries. Okay, keep that in mind. File that away because we're going to come back to that. Let's look at slide 13. On slide 13, a little bit later in the web page, when you go and look at this reference below, a a little bit later on the same page, it says, however, the proposed pandemic treaty has come under fire on social media, mostly from right-wing critics, warning it could lead to countries ceding authority to the WHO. The body strongly refutes this, stressing that governments are leading the negotiations and are free to reject the accord. All right, so here's what they mean by that. You have your own sovereign country. You have your sovereignty still. All right, so that's number one. They can't take your sovereignty away. They can't interject into your government. Let's say they can't obviously interject into your government, because they do have influence behind the scenes in every member country. So they're saying, they won't tell you what you have to do with this pandemic treaty. They will also say that the pandemic treaty is being created by member countries. So it's a collaborative effort among the members. So the UN leadership isn't writing this and pushing it out to the members. The members themselves are writing it. So that's another thing that they'll excuse. But I find it interesting that it says that it's a legally binding agreement earlier in the page, and then below, basically they're saying, but you're free to reject the accord if you don't want to use it. Now, that also brings a difference up of you can reject the accord and not utilize it in your country, but then if you do, it's a legally binding agreement. Legally binding means there's consequences. Let's go to slide 14. And I just want to talk about one section on this slide. It's the last paragraph. It says, it is expected that such an accord would aim to help prevent future disease outbreaks from impinging on people's freedom to travel, work, seek education, and above all, lead a healthy life free of avoidable disease, as called for by another global accord, the WHO Constitution. So you not only have the pandemic treaty, but you have a WHO Constitution as well. They're saying that member states decide the terms of the accord, including whether any of its provisions will be legally binding on member states as a matter of international law. But then they refer also to this WHO Constitution, which is a second document. Again, let's look at slide 15. This question is, what could happen if countries that join or participate in any new accord do not meet their obligations? And it says the response was, it would be up to member states to decide if and what compliance mechanisms would be included in the new accord on pandemic preparedness and response. It's a general principle of international law that once an international law instrument is in force, it would be binding on the parties to it and would have to be performed by those parties in good faith. Just so you know, Joe Biden is all in for this. In fact, he submitted some amendments to it to tighten it more because he thought it was too loose as far as the time to implement. He tried to shorten the time to implementation, and he's been very actively involved in this. So the U.S. will most likely be going with this pandemic treaty. Okay, let's look at slide 16. Last year, the U.S. launched an Office of Pandemic Preparedness and Response Policy. So the White House's website talks about the launch of the U.S. office, but it has no reference to the UN initiative. So what I'm trying to demonstrate here is on slide 16, they're talking about it's false to claim that the World Health Organization has now or will have, by virtue of these activities, any authority to direct U.S. health policy or national health emergency response actions. The WHO has no such enforcement mechanisms, and its non-binding recommendations to member states are just that, non-binding. Any associated actions at the national level will remain reserved to sovereign states, including the United States. Are you seeing the conflict here? We're going back and forth, is it? Is it legally binding? Is it not? Are we taking a position with it, or are we not? Are we going to participate in it, or are we not? So everything's going back and forth. But again, the U.S. launched an Office of Pandemic Preparedness and Response Policy. That was under Biden last year. And the White House said nothing about it, about the UN's initiative on their website. So what I feel like is happening is we've got a lot of look here, don't look over here going on. We've got the UN's agenda as a world order dictating to countries what they need to do. But we have our sovereign U.S. government that's not going to mention that. They know about it and they're participating in it, but they're not going to tell us that. They're not going to say anything about it. Instead, they're setting up a U.S. only office. And they're going to do the same thing the UN wants us to do, but you don't need to know that. You don't need to know that. We're still sovereign. Wink, wink. Okay, so moving on to the Associated Press. In February 2023, they issued an article and they said the WHO has no enforcement and the agreement is non-binding. However, the WHO states above that the agreement would be a binding agreement. The AP article is very early on. So it was written in February 2023, which was early in the process for creating this pandemic treaty, just so you know. So again, I did a search. I pull up the AP article that adamantly states that there's no binding agreement. And then I look at the date, and it was written in February of last year, which again, I know was very, very early in the development of this document. Okay. So is that misinformation? Also, I want you to notice that they flip-flop on terms recommendations versus requirements. There's a lot of flip-flopping on that too. And it depends on which source you look at as to which one it mentions. I want to remind you during the C-19 lockdowns that the WHO recommended that everybody lock down. And what happened? The whole world locked down. It was just a recommendation, though. Nothing to see here. These are not the droids you're looking for. They didn't do anything. They didn't require us to do anything. They just recommended it. And then our government said, oh, we better do it. Better do it. And then they did it. So when they say recommendations, I think they're using that term very loosely. Let's look at slide 17. Another thing that was a communist goal is dominate the psychiatric profession and use mental health laws as a means of gaining coercive control over those who oppose communist goals. We mentioned that already. Again, the lockdowns to me are coercive control. I'm just going to say it. Communist Goal 39. This goal speaks about coercive control in regard to mental health, but could it also be used for physical health? I don't think it's a stretch to say yes. Now we're going to go to slide 18. This is something else that was part of an article by the Heritage Foundation entitled "WHO Pandemic Treaty Remains Fatally Flawed." And so they go through this list of things as to what the flaws are. And I'm just going to talk to you about a couple of them. So one of the things they found is it assaults free speech. Echoing similar language in earlier drafts, the most recent version of the agreement calls on the parties to combat false, misleading, misinformation, or disinformation, including through effective international collaboration and cooperation. Here we see those terms, misinformation and disinformation again. And false and misleading information. I'm so sick of hearing all that. I think we are smart enough to make our own decisions, and if we're not, shame on us. But we should have the ability to have free speech. And if people don't have enough sense to research things or look them up or, research and find out what's true and what isn't, then that shouldn't be a reason to restrict information, because anytime they're calling something misinformation or disinformation, who's making that decision? Ask yourself, who's making that decision? I could tell you so many times I've seen, or I've had it happen to me a couple of times, that I get a fact check warning over something. And when I go, because I'm a nerd, so I go read those fact checks and I research the people who wrote the fact check. 9 times out of 10, they work for some leftist organization. 9 times out of 10, they wordsmith it. So they'll say, well, it's not true because, and they'll pick out one word that gave a different connotation or something. Not that the whole thing isn't true or the concept of it isn't true, but they nitpick and wordsmith it to declare it as false. So I've challenged them before, and I've actually won that, I will say. I encourage everyone to do that. Another issue is that it gives more power to the elites to monitor and combat what they determine to be misinformation or disinformation. And let's look at slide 19. Here's another one that they found. States have, in accordance with the Charter of the UN and the principles of international law, the sovereign right to determine and manage their approach to public health. I'm going to skip the next few things, but I'm going to point out, provided that activities within their jurisdiction or control do not cause damage to their peoples and other countries' sovereignty. Actually, other countries, and we'll leave it there. So what is that talking about? Again, we go back to the fact that they state that they're not forcing anything through this pandemic treaty, and there's no enforcement, they're not forcing anybody to do it, et cetera, et cetera. But in their own wording, they said, provided that activities within their jurisdiction or control do not cause damage to their people and other countries. So if they determine, and this is from an article called Who Pandemic Treaty Draft Reaffirms Nation Sovereignty to Dictate Health Policy by factcheck.org. Speaking of fact check, I'm going to use them in this case. They're saying, nothing to see here, no problems. But then they come back and state, unless there's potential damage to the people in that country or other countries. Well, I don't know about you, but do you know any country that doesn't do business outside of their own borders? Do you know people who, like any country where people don't travel across borders? Because I don't. I mean, there could be some small country somewhere that I'm just they're not even on my radar that could have that. But nowadays, we're constantly flying to and fro, and we're doing business in other countries, and part of that is travel, and part of it's vacations, and there's just so much crossing borders at this point because of globalism and because of the world's kind of feeling smaller as time goes by. I don't know of any occasion where there wouldn't be a situation with a pandemic that wouldn't cause damage to your own people or other countries. I'm just saying. There's something else they talk about too, and that is equity of costs among countries. Just to point out, the U.S. costs for pharmaceuticals is 256% higher than in other countries. 256%. We carry it, and I've been in the industry for over 30 years, so I know this to be true. The U.S. is charged so much more for any pharmaceuticals that we use because we carry the costs for underdeveloped countries. We pay for them, essentially. Let's look at slide 20. I'm going to jump down about halfway through. It says U.S. prices were 256% of those in the 32 comparison countries combined in comparison with individual countries. U.S. prices range from 170% of prices in Mexico to 779% of prices in Turkey. A couple bullets later, U.S. prices were 84% of prices in all non-U.S. countries for unbranded generics, but U.S. prices were 190% of prices in other countries after adjusting U.S. prices downward to account for rebates and other discounts. So we're still at 190% minimum of what other countries pay. This is all according to the International Prescription Drug Price Comparisons, and there'll be a link below to that reference. Let's go to slide 21. This is talking about the pandemic treaty again. A glaring oversight in the current draft is the failure to define developing country. Do you know that currently China is considered a developing country? They have so much in population. Their financial state is doing super well, but they're a developing country. So they're pointing out, without clarification, China will be considered a developing country in this pandemic treaty and benefit from arrangements intended to help low-income countries. There are provisions in the pandemic treaty about countries and equity, and we talked about that a little earlier. So they're expecting those who have to give to those who have not and carry the load for them, China being one of them. Guess who gets to determine who the developing countries are? The WHO, because they are the authority, apparently. It's based on, who's required to turn over their medical supply stockpiles and who's going to receive those medical supply stockpiles in the name of equity. It also eliminates intellectual property, which is a bad thing from a financial perspective, because even though I'm not a big fan of the pharmaceutical industry myself, I do think as a business, they do have intellectual property, which is their patents on their drugs and things that they own. This pandemic treaty will get rid of that, which means it's a free-for-all for anybody who wants it. So like in the case of the last pandemic, you necessarily wouldn't have Moderna, Pfizer, Johnson & Johnson. They would all be making the same thing, potentially. So that's just something that I thought was interesting. And again, there's a reference below for the link to that resource. So we're talking impact, significant impact to us through enforcement, financial impact, and so on. Now, while Joe Biden has been involved in this pandemic treaty, and he would go full steam ahead, we have the safeguard that it requires an approval by 2/3 of the Senate to ratify it for the U.S. So what are you going to do to fight this? If you do not agree with everything that's in this pandemic treaty, you see the risks around it, be sure to call your senators and tell them you don't want it. And it's urgent because, like I said, this is due to be voted on in May of this year. All right, let's move on to mental health. The WHO's Special Initiative for Mental Health in 2019 is an actual initiative by them. It was rolled out in 9 countries, but the U.S. isn't one of them yet. So right now it's only in 9. They're trying to pilot it for use in other countries. Each country completed an assessment resulting in country priorities. So they did an assessment and then they decided what to prioritize out of that. Let's look at slide 22. This is the initiative, Transforming National Mental Health Systems. There's an article that will be linked below to the resource for this. The CDC, even though the U.S. hasn't done this and hasn't participated in it, don't be fooled. This Center for Disease Control in the U.S. is absolutely on board with everything that the WHO and UN provide. So I want to look at slide 23. There's a website called About Mental Health at cdc.gov. That's where these snippets are going to come from. According to them, how common are mental illnesses? It says more than 1 in 5 U.S. adults live with a mental illness. Over 1 in 5 youth, ages 13 to 18, either currently or at some point during their life, have had a serious, debilitating mental illness. And then about 1 in 25 U.S. adults lives with a serious mental illness, such as schizophrenia, bipolar disorder, or major depression. I have so many theories on this, but I'm not going to go into those. Too personal. And let's just stick with the facts today. Slide 24, they go in to talk about what causes mental illness, and they say there's no single cause for mental illness. A number of factors can contribute to risk. They're talking about adverse childhood experiences to other medical conditions, biological factors or chemical imbalances in the brain, alcohol, drugs, having feelings of loneliness or isolation. All right, that last one. Who hasn't felt lonely or isolated? Did you feel that way during the pandemic? Have you ever felt that way outside of the pandemic? This is one of the concerns I have about this mental health stuff, because I could tell you when my son was young, as an example, the schools were trying to label him saying he had ADD. And so I started digging into research, and I got a pamphlet, a brochure from him, and had a list of symptoms on the back. And I read all those symptoms and I went check, 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 check. And so I thought, well, maybe I have ADD. So I started asking all my colleagues and friends to look at this brochure and tell me if they've had any of those symptoms. And every single person I gave it to said, yeah, I've had them all. This is where it gets scary for me, because if you're labeled with a mental illness, there are implications to that. There are consequences to that. And are we over-diagnosing that? That's the thing that hits me hard. So, slide 25. That last sentence, mental health as a continuum and the identification of specific mental disorders are both ways to understand how well children are doing. So now we're talking about kids with mental health. And if mental health is a continuum, then what's the common denominator for it? Who determines that? Is anyone truly mentally healthy? Do you know anybody who you could downright say, without a shadow of a doubt, they are mentally healthy? They don't ever have depression. They're never sad. They never anxious. They never. Or they're always. If you do, then you probably don't know them very well. And you better go ask them. Because I don't know of anybody who doesn't have symptoms of something on occasions. Or even if those occasions may be for an extended period of time. Okay, but then everything cycles. You go in, you come out. You develop coping skills. Kids particularly don't have coping skills. Have you seen a kid get mad because you wouldn't give them ice cream? or because you said, no, we're not going to McDonald's right now. Even if you meant to go an hour later, they throw a fit because they go right into anxiety and anger and behavioral problems. All right. It's especially dangerous with kids. As adults, we kind of know more and we regulate more. Kids don't have those coping skills yet. So I personally, I've done so much research on this, and I was part of a parent group for almost 2 years where that's all I did in my spare time was research this stuff about kids and the schools and the initiatives going on with them and the mental health aspects. And I can tell you, every kid could be labeled. Are you willing for yours to be? Do you know what the consequences could be? It only takes one activist in a school that has access to your child to make a difference, a significant difference, especially if it's a teacher that has them even an hour a day for a whole school year. There are agendas, whether we like it or not. Let's go to slide 26. Here we go with the mental disorders for children. Let's look at them. Anxiety, depression, oppositional defiant disorder, conduct disorder. I don't know the difference between the two of those, I have to say. Attention deficit and hyperactivity disorder, Tourette syndrome, obsessive compulsive disorder, post-traumatic stress disorder. And then it says other conditions and concerns that affect children's learning, behavior, and emotions include learning and development disabilities, autism, and risk factors like substance abuse and self-harm. All right. Again, it's kind of like the American kids are starving concept. I dug into that at one point. Do you know how they determine that kids are hungry? They're going hungry? Because they asked on their survey a question that said, have you ever been hungry? Do you know any kid who hasn't at some point been hungry? I'm not kidding. No joke. Look it up. I feel like this is the same kind of thing. Have you ever been sad? Have you ever been nervous or anxious? Every kid I know would have to say yes if they even knew what those words meant, because we all have these at some point. Let's go to slide 27. And I want to point out here that it says public health includes mental health. So when the CDC, the UN, the WHO talk about public health, mental health is always a part of that. There is an initiative out of the CDC, and this is what I want to move to next, called the Whole School, Whole Community, Whole Child Initiative. Let's look at slide 28, please. This has been out for a while. Most people don't know about it. So let's just read through. The Whole School, Whole Community, Whole Child, or WISC model, we call it WISC, WSCC model, is CDC's framework for addressing health in schools. This model is student-centered and emphasizes the role of the community in supporting the school, the connections between health and academic achievement, and the importance of evidence-based school policies and practices. It has 10 components: physical education and physical activity. Number 2, nutrition, environment, and services. Number 3, health education. Number 4, social and emotional climate. Number 5, physical environment. Number 6, health services. Number 7, counseling, psychological, and social services. Number 8, employee wellness. Number 9, community involvement. And number 10, family engagement. Love how they put that at the bottom when you're dealing with your own kids. So again, we see a pattern of these organizations, these government entities injecting themselves into our lives, every aspect of our lives. Now we're going to focus on how they're doing it with kids. They actually do surveys with kids, interviews with kids to learn about their home life. You think your home life's private? It's not. These schools are using that data to come up with new initiatives or behavioral treatments or whatever. So don't think it's private. You can opt out of any kind of surveys at school. You have to do it though, and they don't tell you that. There are two forms, opt-ins and opt-outs. An opt-in means they don't offer it as a standard, and in order for your child to have it, you have to sign a paper. The opt-out is they offer it as a standard, and you as a parent have to sign a paper so your kid doesn't do it or participate. These kind of questionable things when it comes to kids, I think should be opt-ins, not opt-outs. Because papers get lost in book bags. Parents don't know. They have to sign something. They don't even know what's coming up. You don't even know what's happening unless you see the form in the paper, or you get an email from the school or a parent portal or something. And if you're not on top of that, then you won't know what's even happening. So I think it's just safer when it comes to dealing with kids to have an opt-in. So this WISC initiative, I'm going to take you through their virtual school in a minute. But the end game for the CDC's WISC program is to have everything on site for kids at the school. What do I mean by everything? We're going to talk about it, and you'll see what I mean. It's everything that could fall under the term health. You're talking dentists, doctors, optometrists, school counselors, nurses, referral services, on and on and on. Parents actually are embracing this more than I thought they would, because parents are like, woohoo, if the dentist is on site and the doctor's on site, I don't ever have to leave work to take my kid to the doctor or dentist. They can just do it at the school. The problem is, doing it at the school as part of these initiatives, they don't have to tell you what they're doing because it falls under health. So they don't have to tell you. All right, slide 29. We talked about the high level stuff. Let's talk about kind of the lower level stuff. I want to dive in particular to the social and emotional climate. You may have heard the term social and emotional learning, SEL. Schools will tell you they don't teach critical race theory, CRT, because that's only a class in colleges and universities. They don't teach that in schools, in the lower schools. It's a flat out falsification. It's misinformation. How about that? Because CRT is a theory. SEL is a program. SEL is built on the CRT theory. That's part of it. So they're technically right in that they don't teach CRT at school. So be careful if you're trying to, confront somebody about it. They don't technically teach CRT. They just incorporate the method into the SEL part of the learning. And by the way, all schools pretty much are doing social emotional learning. And you're going to see it comes from the CDC, which is aligned with the WHO and the UN. Social emotional learning in particular has serious impacts in my mind. We'll get into a little bit of it through the next few slides. Let's go to slide 30. This is a virtual school on the CDC's website that you can go through a link and get into and kind of move your mouse around, and it'll highlight different things on the screen that it'll blow it up so you can read it and you can click on it and then you can learn more about it. So the next few things that we're going to talk about are just based on that. First thing I want to point out is, go back to the slide, the red box around the white and blue banner at the desk. It talks about counseling, exams, dental, and vision. So that right there demonstrates to you they want to have dental, vision, everything under one roof. This is the health center, by the way. So in the health center, they talk about the different things there on the blue and white banner. On the yellow notepad paper, there's different options you can click on if you're online, and you can go into each one of those. I'm going to go ahead and tell you. So when I clicked on the whiteboard and the pop-up came up, things that were included in the services are primary care services. So you're talking well child visits, preventative screenings, including vision, immunizations, and chronic disease management. They also provide sexual abstinence counseling, pregnancy testing, STD infection diagnosis and treatment. They provide dental care. They provide behavioral health counseling and health education on topics like eating, active living, smoking cessation, and weight management. So I kind of think, I don't know about you, but I kind of think about this and I'm like, man, as an adult, wouldn't it be grand if we had a workplace that had all this on site too for us adults? So we could have it so conveniently located and actually deal with adult topics that shouldn't be addressed with kids, really. Things like birth control, reproductive health services. Now, reproductive health services, just so you know, includes abortions. It does. It could be the abortion pill. It could actually be the abortion procedures, depending on how far along they are and so on and so forth. That will be on site at the school. And guess what? Because there is a UN initiative where they designate children's rights, you don't have a right as a parent to know their health information. HIPAA applied to adults typically, and minors were not considered as part of that because as a guardian of a minor, you were entitled to their health information. But they came out with a new children's rights thing. And so part of the rights are protected health. And just so you know, the schools don't use HIPAA. They use a different thing. I can't recall what the acronym is off the top of my head, but they don't use HIPAA. They use a whole different thing for determining their privacy at schools. Something else it stated was the SBHC staff, which is this, nice little graphic that we had for the health center, includes a licensed social worker, which they typically have that on site now, but they're in charge of behavioral health. They collaborate with the school counselor, health center certified health education specialist to offer support groups for students. They go into physical, social, and emotional health issues. They're trained in behavior change theory. They work individually with students interested in making changes such as decreasing substance abuse or improving nutrition. I want to point out also, as I was going through these little virtual school rooms and reading about them, that there is never a mention of parents. Never. It's all the children decide. The students decide. Their loyalty is to the students, not to parents. And many employees of schools will tell you that. They'll tell you that straight up. They are not concerned with parents. In fact, a lot of them think you as a parent are either neglectful in your duties and they're better at it than you are, or that you're an abuser in some way, shape, or form. They believe that parents are, and I'm saying this loosely, so there's always exceptions to the rule, but as I mentioned, I was very, very into the research about this, about what's going on in our school systems, because I have a personal story about it that drove me to do a bunch of research and try to figure out what the heck was going on. I can tell you also, I mentioned this last time, all you have to do is go to Reddit and follow the teachers' threads on there, and you'll see it for yourself. I also have attended statewide events for school employees. I did it undercover and I heard everything that they said. And they don't think parents know what they're doing. They're better at parenting than you are. So you're always going to have these fights, these conflicts in these school systems. And I'm talking about the government schools, although it's infiltrating into others as well, because we've for decades now put children first instead of letting them know their place and actually guiding and directing them on how to behave. So anyways, and on that same screen with the health center, it says support efforts in your school district to identify community healthcare providers who may be interested in various levels of partnership with your schools. And be sure to consider the spectrum of health and well-being services your student may need. Then we go into the yellow page box. And we're going to look at some of the things that are included in that. So slide 31, please. Something I want to point out, I'm not going to read this whole thing, but in the second sentence, it says the school invites a community healthcare organization to provide services in its facility. So the school does not own or operate these healthcare centers, just an FYI. It's some organization in the community, could be a health network, whatever, which makes it independent. The office manager uses several reimbursement mechanisms. So they're covered by Medicaid. They do direct bills. They take private insurance. They're self-pay and CHIP coverage. So if you're on the health insurance plan, Obamacare, it takes that. They also receive public and private sector grants. Right now, there are more than 2,000 school-based health centers across the nation in 49 states, and many are federally qualified health centers, FQHCs. If you hear the term FQHC, that's what that means. If you haven't heard it, again, it's a situation where they name it something completely random. And so it's very hard to follow all these things because literally you could have a detective board on the wall and put pictures up or names of organizations and tie them all together with yarn because there's so many of them and they just make new ones and name them something different. It's hard to keep track of it all. Slide 32, please. So in this example, in the virtual health center, they offer primary care, behavioral health care, and preventative education and support services. They quickly provide appropriate referrals to specialists. This is interesting. It says they seek to promote overall health for each of their patients. To do this, they do not simply focus on these single issues, such as a cold that may have brought the student to the center. Rather, they use the visit as an opportunity to assess how conditions in which the students live, learn, and play may affect their health risks and outcomes. The students fill out a brief survey. This is the survey I was telling you about earlier. All the schools have them now. Just so you know, there's a government official whose brother is actually on the board or the CEO of Panorama. That's one of them that's well known. Panorama makes a ton of money because they're the company that has the software that captures all the data from the surveys that they're giving these kids across the nation. They fill out a brief survey while waiting to see the provider, and then the staff can identify red flags such as, and I underlined it in red, unstable home environments or risky behaviors that affect a student's health and well-being. The providers have a protocol for discussing potential issues with the students and providing appropriate referrals to community organizations and providers, such as social service agencies and substance abuse treatment centers, or abortion clinics, or healthcare providers that will issue hormone blockers or gender treatments, just so you know, because those all fall under social service agencies. So, and again, they have a different way of handling the privacy issue according to the kids' rights. So you as a parent don't have to be notified. But I do want to point out how a kid could essentially go to this clinic with a cold, and the staff will use a cold visit to investigate how the student lives. That includes your home. That includes how you discipline your kids. That includes what you teach your kids as a Christian. So beware. It's in their documentation. Let's go to slide 33. Third line, the health center is reducing inequities in healthcare access for children in their community. How are they doing that? They're issuing immunizations, flu shots, and wellness visits. So are you a parent that, you get the regular shots, but, these extra shots like the jab we had from the last pandemic and the flu shot, those are just a little too over the top. Like, you don't want your kid jabbed all the time with stuff. You don't want them to have more than they need, because you understand, take it from me, who's been in the pharma industry with clinical trials for over 30 years, that those clinical trials don't start out with the intention of testing drug interactions among different products. That includes vaccines. Okay? So if you're taking one drug and then they prescribe you another drug for something else and another drug for something else, the only way these companies know that there's a problem is if somebody in the clinical trial or the observational studies, phase 4, or even years later, happen to have an adverse event and they can trace it back to that interaction. That's the only way they know. You as a parent may understand that, and so you don't really want your kid to have those shots. But in the health center, they're going to give them to them, and you don't have a say-so. Okay, so now I decided to go from the health center, and I jotted down to the counselor's office in this virtual setup. And so here's what I found there, and I'm going to go through these very quickly. Let's go to slide 34. The resources, last sentence of the first paragraph, the resources address the behavioral, mental, and emotional health of students. Students, parents, and staff borrow these resources. They can suggest ways to promote student achievement and solve behavioral issues. So, and even in the first sentence, it says these library of books, movies, and audio media on topics related to academic, career, and social and emotional development. Again, social and emotional stuff is basically personality characteristics and values. All right. So why does a government agency, again, a school system, feel like they're the authority and able to teach your kids values, the way they should behave in certain circumstances, the way they should perceive things, because that's emotional, right? How are they the authority and not parents? I understand that there are parents who are abusive to kids. I understand that there's problems with that, but I do not believe that's the majority. That is a minority, and the schools have ways of finding out about abuse, and they have mandated reporting. Okay? So that's already being handled, in my opinion. But for them to take these liberties to teach your kid values and behaviors that they want them to have, again, who makes the decision on what good means? Who makes that decision? Do you have any idea? I don't know. Let's go to slide 34. This is in the virtual counselor's office, and this is dealing with the bookshelf. Again, they're trying to solve behavioral issues. Let's go to slide 35. This is a diversity poster that was hung on in the classroom, I believe. And the diversity makes us stronger statement is on there. And again, this is one of those things that sounds so virtuous and benign. Of course, everyone embraces diversity. But the problem is diversity, according to CRT, which is taught through SEL, is all about the oppressed and the oppressors. And the theory, the critical race theory, is that white people are always the oppressors, always. And people of color are always the oppressed. I'd like to see how they apply that to South Africa right now, because it's the complete opposite. But who am I? So that's where I have a problem with diversity. Another way I have a problem with diversity, and I know this is happening through SEL, let's say the thought of the day or the value you're trying to teach that day is respect for others. Sounds completely harmless, benign. Everybody would be on board with that until Johnny wants to be called June and have she, her pronouns. And your child, as a Christian child, knows that's not right. And your child doesn't want to call them June and use those pronouns. Guess what? Your child is not being respectful to others. So they're going to be punished for that. And they do these things called restorative circles, which if you listen to teachers, they don't work. The thought of the restorative justice circle is to get all the kids in a circle and talk about an issue that happened, and then try to make amends between the two offended kids or whatever. It doesn't work. Bright people coming up with these things. So on this one, it talks about Ms. Kowalski identified a trend that kids have become more diverse. So she incorporated lessons in tolerance throughout the counseling program. Now, I literally sat in on a breakout session at a state convention for school employees. And I went to the session on SEL. And boy, did I learn a lot. So one of our school administrators here locally was opening up, because just so you know, this wasn't marketed to the public, right? So everybody there, probably except me, was some form of school employee. So they've done this before. They do all the, teacher workshops and stuff. And I'm going in blind because I want to know what they're talking about. So I went to the session on DEI, which I mentioned I called DIE on purpose. And I went to the session on SEL. And what I learned in the SEL session is it's gotten a bad name because parents have found out about this SEL thing and they're in an uproar about it. So they don't teach a class on SEL. Now, what does that mean? In Indiana, curriculum has to be shared with parents, and it's like that in many states. So you have to define curriculum. That's lesson plans, etc. Anything they throw in, though, or just say is not curriculum. So there's these great YouTube videos on amaze.org that are cartoons for young kids, and they teach them about things like, puberty topics, but they're in slang terms. They teach them about abortion. They teach them about, and they're just 10-minute videos. So and I've heard teachers doing this. They pull a video up on that topic and play it in the classroom. And guess what? Because it wasn't pre-planned and it's not part of the lesson plan, they don't have to report it to you as a parent. I encourage you to go look at the YouTube channel and watch some of the videos from amaze.org. They are disgusting, first of all, but they're counted as a resource, a teaching tool. So they're not curriculum. They don't have to be reported. Likewise, at this, event I went to talking about SEL, they admitted stuff like, well, for the SEL topic of the day, They have a calendar made up as a school. Administrator made it up, I believe. And so each day they have a special topic to discuss, and we'll just use respect for others as the topic. So in homeroom, they get all the kids in a big circle and they talk about the value of the day, respect for others. And the teachers use that opportunity to teach them things like, you need to respect others' pronouns, you need to respect their names, their, whatever, gender, whatever. But it doesn't stop there. They actually talked about how every teacher throughout the day will start their class off reinforcing that topic. And again, none of that has to be communicated to parents because it's not curriculum technically. They're just doing a circle training in the morning. It's impromptu, informal. They're incorporating it in at the beginning of math class and English class and every other class that these kids have. So again, they don't have to report it. And they know that, just so you know. So I don't know how you find out what's going on in your schools short of going in undercover or just, I don't know, because, the schools are on lockdown now. You can't even go in. The only reason so many parents came out about their anger about things that were being taught and even knew about it is because of COVID and doing e-learning. They don't bring textbooks home anymore, so you have no idea what's in those, really. So I don't even know how you fight this or identify what's going on. Homeschooling is the only thing I could think of. So here's how she did it. She placed posters in her office and around the school showing diversity and tolerance. They relate to accepting and building relationships with people who are from varied cultures, religions, and ethnic backgrounds. Now, as Christians, we want kids to be accepting of other cultures and backgrounds, but it seems like there's a mixed message because they want you to accept people, even as adults, of other cultures and backgrounds, but yet you can't dress like them or have a piece of jewelry like them or say things like them or wear hoop earrings like them or whatever because you're appropriating now. To me, it's stupid. To me, it's honoring that culture and ethnicity. It's not a situation of appropriating. I guess it depends on the attitude, but I just think it's kind of out of control myself. Okay, so then it says also of all body types and genders. So here we go with the gender stuff again. In addition to posters, she communicates inclusion when she engages with students in counseling sessions, in classroom guidance lessons, and throughout the comprehensive school counseling program. And again, this is on the CDC's website. Let's go to slide 36, please. This is talking about the formative assessment tool. And like I told you before, they're doing surveys on kids. You have no idea what's in them. I could tell you from reports of teachers and parents around that they do have questions on them about the child's home life. So, and it's going to be from the child's perspective, and they will take action on whatever they find that's concerning from the child's perspective. So just be aware of that. On here, it talks about a variety of health topics, including mental health first aid, meeting the diverse cognitive, emotional, and social needs of students, sexually transmitted disease and pregnancy prevention, and then talking about suicide. This is talking about how this particular school ensures that the staff receives professional development on these things. Now, professional development is not training as a counselor or mental health professional. All right? Professional development is not that. It's different. So now you have teachers in a classroom setting who are supposed to handle by themselves, unilaterally, basically, a first line of defense for mental health issues or behavioral issues that are coming up. And I tend to think they're not really qualified to do that. If you're going to have somebody do it, it should be a licensed social worker or a school counselor, not the teachers. And how unfair is it to put that responsibility on the teachers? They already have enough to do. They already have enough to do. And I'm sticking up for them in that because I have a family full of teachers, so I know. Anyways, that's part of what they want to do. And then let's look at slide 37. This is also in that space. I want to point your attention to the safe zone sticker or thing on the board. On the safe zone, it says, I am an ally. This is a safe zone. And so when I click on the box for all of these posters, the pop-up box, dialog box said, she also makes it known to her classroom this is a safe space, meaning students can privately talk with her about concerns or issues they may have in a supportive and non-judgmental environment. Again, I'd like to think that's a good thing, but have you seen some of the teachers on TikTok? I'm not sure I want my kid talking to them about private topics. And second of all, again, these are private topics, so you don't have to share it with you. So just be cautious about that. I want to just point out the schools are taking over all forms of health care for kids, just so you know. Mental health, physical health, and that will impact the spiritual health because there are conflicting things in the mental health arena to our scriptures. And they're crossing a boundary that I feel is very dangerous to us as Christians and influencing kids in a way that we don't approve of. So just know that. Let's go to slide 39. Remember the communist goals. Emphasize the need to raise children away from the negative influence of parents. This is goal number 41. Attribute prejudices, mental blocks, and retarding of children to suppressive influence of parents. Again, I told you earlier, a lot of teachers do not see parents as allies. They think we're stupid, that we don't know what we're doing, we're insufficient, we haven't been trained in the universities to handle these kids professionally. I've heard it all. So not all of them are like that. I have to keep saying that before you start sending me comments that I hate all teachers. I don't. But I've seen a lot of this. So this is just warnings to think about. There's a couple articles I'm going to close out with from Psychology Today. One is from 2014, and I'm going to read this off. Phil Zuckerman, PhD, writes about his view on Christianity and the effects on children. He described taking his 5-year-old daughter to a Catholic church for a school assignment, which I don't know what kind of assignment that is, but anyways. And he describes her terrified reaction to everything because she'd never been exposed to anything about the death of Christ. And so she goes into a Catholic church, and, you know, if you've been in one, there's statues, there's crucifixes with Jesus on the cross and blood dripping down and things like that. And so apparently it terrified her. So here are some of his positions. Let's look at slide 40. Again, this is Psychology Today. That's a leading resource for people in that field. And this guy's a PhD. So he says, but how does a secular parent explain such gore to a 5-year-old? Well, you see, there are millions of people who think that we are all born evil and that there's an all-powerful God who wants to punish us forever in hell. But then he had his only son tortured and killed so that we could be saved from eternal torture. Get it? And that's very sarcastic, what he's saying. Let's go to slide 41. The whole thing is so totally horrible, absurdly sadistic, and counterintuitive and wicked, not to mention badly untrue. Again, is he an authority? And ever since that day, I've been acutely aware of the ways in which certain doctrinal aspects of Christianity can be harmful for children. While this list is by no means exhaustive, here are some specific ways in which the more ardent, literal forms of Christianity can potentially harm children. Slide 42. Christianity teaches children that they're intrinsically evil. They did nothing wrong, but just by being born and being alive, they're evil. This is a terrible thing to teach children, not only because it's false, but because it's the exact wrong message children should be taught, which is that they are intrinsically wonderful, noble, and lovable, and that they have the boundless goodness inside them. Christianity teaches children that there exists a powerful evil devil, a most dangerous demon. Beware! This horrible falsity infuses their childhood with needless fear and dread, and teaches them that the world is a dangerous place with a malevolent demon lurking in the wait. In my own research, I've interviewed many adults who describe the whole Satan thing as a decidedly traumatic element of their children, and in some egregious cases, unambiguously abusive. Slide 43. Christianity teaches children that God killed his own child to make up for our wickedness. In other words, we are evil, and by killing his own child, our evil is somehow wiped away and forgiven. Our guilt is cleansed. But how does that work? If I abuse my wife and then a cop comes over and kills my son, does that atone for the wickedness I committed against my wife? Blah, blah, blah. Moving on, Christianity teaches children that those who accept Jesus as their personal Savior are good, saved, going to heaven, and those that do not accept Jesus as their personal Savior are sinful and destined for hell. Slide 44. Christianity teaches children that masturbation is evil. It's not. It's natural, normal, and healthy and pleasurable. Teaching children to feel guilty or ashamed of masturbating, teaching them that doing so is disapproved of by a son-slaying God and can even land them in hell. This is all nonsense. But more than that, potentially abusive. What are we talking about with the emotional stuff the schools are doing? Okay, slide 45. And despite everything that I've said so far, I could surely write many pages on all the good that certain forms of Christianity can do for children. Christianity can provide comfort and hope for children in dire straits. It can prod children to be charitable and altruistic. It can develop within children an ability to be forgiving, blah, blah, blah. He talks about a camp he went to, and then he says many versions of Christianity focus on Jesus's ethical teachings, foster love, and bring out the best in our kids. Okay, so many things to say about this guy. First of all, why would you take your 5-year-old daughter to a Catholic church as an adult without preparing her and explaining what it is? That's number one. I don't find that to be good parenting. How about that? Second of all, if she did have a reaction, where were you in explaining it to her after the fact? You could have done that too. Number 3, our God is a God of love, but he's also a God of judgment. He's holy. He's righteous. And he's just. And you can't go doing bad things even in this world. You're not supposed to be able to, I should rephrase that, without consequences. All right? Don't you think that a holy God who's perfect and expects perfection would do the same? Give you consequences? And he didn't want to kill his son. That's another thing. He knew that was the only sacrifice that was going to suffice, because what this guy's missing is the fact that we are born into sin. Do children cry when there's nothing wrong? Isn't that a form of lying? Do they pretend that I fell down and I hit my knee and now I'm going to die? They overreact to things. That's a form of lying too. Do they bite? Do they hit? Do they hurt people? They hurt things? They break things? Yes. That is natural behavior because we are born into sin. That's just what that is. He's missing that whole point. But the dangerous thing to me is not what he believes. I couldn't care less what he believes. What is dangerous to me is that statement on slide 44 at the bottom where he says, this is all nonsense, but more than that, potentially abusive. He is a psychologist. He's in a position of power to act on child abuse. He's a mandated reporter. He could easily report that, and then you'd have a fight on your hands. And there are more of those than I think are of us in that field nowadays, just to be fair. So there's another article on Psychology Today called How Religious Fundamentalism Hijacks the Brain. And the sidebar to it is Fundamentalist Ideologies Act Like Mental Parasites. And it's by Bobby Azarian. He's also a PhD. And he basically he says religious texts or leaders discourages any logical reasoning or scientific evidence that challenges it. The fundamentalist ideologies can be thought of as mental parasites. Let's look at slide 46. In much the same way, Christian fundamentalism is a parasitic ideology that inserts itself into brains, commanding individuals to act and think in a certain way, a rigid way that is intolerant to competing ideas. We know that religious fundamentalism is strongly correlated with what psychologists and neuroscientists call magical thinking, which refers to making connections between actions and events when no such connections exist in reality. Without magical thinking, the religion can't survive, nor can it replicate itself. Another cognitive impairment we see in those with extreme religious views is a greater reliance on intuitive rather than reflective or analytic thought, which frequently leads to incorrect assumptions since intuition is often deceiving or overly simplistic. And he says so much more. I won't go into all of it, but these are leaders in the psychological industry. They're the ones that are influencing those who serve in that capacity. And more, we as Christians know the world's becoming more and more secular as the days go by. We are becoming the minority, if not already. And so we have to be very guarded about ourselves and our kids in this world. I think that thinking about the WHO and the UN, they say themselves they're the new world order. They have a globalist agenda. We've talked about how the globalism elevates, like these entities elevate themselves to be in place of God and tell us what we can do and can't do, should do and shouldn't do, invade our lives and our livelihoods and how we operate. They affect the physical, mental, and ultimately the spiritual health that we have. We have one Lord over our body, and we don't answer to any human government as far as things outside of keeping the law. All right. In America, the federal government's main role was security. That's out the window. We have open borders. We have all that going on. Very little security. I just saw that we're down 24,000 military people, and they've basically depleted almost our resources in the military. Security and borders is out the window for that. And they're supposed to ensure our ability to pursue life, liberty, and happiness. The pursuit of happiness, not happiness itself, but the pursuit of it. And so I feel like they're in the way of Christianity at this point because we don't really have that freedom anymore. I do want to say not all world objectives are bad for us. I'm not trying to say that. What I'm trying to say is look at the evidence that we presented. Look at what we've looked at. Look at stuff from their own website, things out of their own mouths, and tell me how they're not in conflict with our Lord God Almighty, how they're not trying to set themselves up as the authority and the Lord of all, because I believe they are. We need to use discernment in these days. I do want to remind you, if you don't support the pandemic treaty, be sure to call your senator and voice that, because the voting is in May. Definitely get involved in elections. Look at the policies, look at the platforms, for goodness sake, and then be deciding who you need to be electing, because we need to get people in our government that are going to fight the UN agenda, this globalist agenda, not pursue it. And right now we have people pursuing it. Make sure you follow your local bills and national bills. that are in legislature, because again, you do have a say-so in that. Find a local group, stay informed, and pray, pray, pray. So in future shows that are going to be coming up, we're going to be talking about the war on children and parents more. We're going to be talking about gender ideology more. We're going to be talking about the war on farmers that's going on, climate change and their agenda, and so much more. So if you like the content and you want to see more, be sure that you're liking, sharing, subscribing, and commenting, because we need that to get pushed up in the algorithm. And I do want to close out, as always, by saying a special thank you to Revolver Broadcasting for producing the show. Be sure to go and check out revolverbroadcasting.com for more content, and I'll see you next time. Thank you.